Good afternoon. I'm Randy Ruta, Chief Executive Officer at the National Health Council, and I'm pleased to welcome you to our webinar on keeping misinformation off the menu this holiday season, practical tips for engaging family and friends. This session is hosted by the National Health Council in collaboration with the Association for Professionals in Infection Control and Epidemiology and the PAVE Center at the University of Maryland, Baltimore. For the past 2 years of this COVID pandemic, every public health recommendation has been challenged in one way or another, or just outright dismissed by some. What was once seen as nonpartisan, health-focused messaging has been turned inside out and upside down by those with a partisan agenda. All of this has stressed and strained relationships as we navigate interacting with friends and family during a global pandemic. So how do we keep misinformation off the menu? With us today is Dr. Devin Jopp, CEO of the Association for Professionals in Infection Control and Epidemiology, or APIC, who will provide some tips and messaging we can use to help battle that misinformation that has permeated our pandemic conversations. Dr. Jopp joined APIC as CEO on December 7th, 2020. He brings to APIC more than 2 decades of association leadership with a wide array of experience and accomplishments from across the healthcare and nonprofit sectors. He has been recognized as one of the top 100 most influential healthcare leaders by Healthcare Management International magazine and one of the 50 top healthcare IT experts by Health Data Management magazine. Prior to APIC, he served as CEO for the American College Health Association, the principal leadership organization for advancing the health and well-being of the nation's 20 million college students and their campus communities through advocacy, education, and research. He has previously served as president and CEO for the Work Group for Electronic Data Interchange, WEDI, a national nonprofit advisor to the Secretary of Health and Human Services focused on enhancing the exchange of healthcare information. Joining Dr. Jopp for our fireside chat this afternoon is the National Health Council's Jennifer Schleman, our Assistant Vice President, Marketing and Communications. Jennifer provides strategic direction for all of the National Health Council's marketing, communications, public relations activities, and is the steward of the National Health Council brand. Using her more than 25 years of professional experience, she's continually developing and improving communications approaches to advance the National Health Council's mission, program strategies, and values. Prior to joining the National Health Council in December 2016, she was Senior Associate Director of Media Relations for the American Hospital Association, where she focused on quality of care and physicians issues. She's also worked in a variety of communications roles for the International Food Information Council and for the public relations firm based in Washington, D.C. and Cincinnati. With that, let me turn things over to our fireside chat panelists. Go ahead.
Thank you, Randy. As we all know, the holidays can be a stressful time of year. Add to that a global pandemic and an environment rife with misinformation. You have the recipe for potential conflicts with family and friends. So what can we do to minimize misunderstandings and increase peace on earth? I'm excited to have Dr. Devin Jopp here to help us sort out fact from fiction and provide some tips on handling misinformation related to COVID and other infectious diseases. I have a few questions for Dr. Jopp, then we'll open it up for questions from the audience. If you have a question, please put it in the chat function and we'll try to get to as many as possible. So Dr. Jopp, welcome, and let's get started.
Sounds great. Thanks, Jennifer. And thanks all for joining today. Quite a timely topic, and look forward to making sure that the food stays on the table and not in food fights over the holidays on misinformation.
That's exactly what we want to do. So my first question for the National Health Council, our goal is to advance health for the 160 million Americans living with a chronic disease or disability. And a lot of times it can be difficult to spend time with family when people have different views about the precautions that should be followed to minimize the spread of COVID-19. So how can patients and their family caregivers stress the importance of vaccination and social distancing during holiday gatherings?
Right, so big topic here. And I think, kind of going back a little bit before the pandemic is we have to understand that misinformation is actually not new. We've had misinformation for centuries, going back to politics, right, back in the Imperial Roman Empire days. And so when we look at misinformation, we think about this, or sometimes we talk about fake news. But there's kind of two sides of this coin, which is what kinds of information is intentional disinformation versus who's intentionally seeing this information, unintentionally seeing this information, and turning it around and spouting it out as fact, right? So a lot of times when we're dealing with family members, right, they may be completely unaware of actually the nature of the content that they're actually looking at, and then turn it around and espousing. And so I always say that you have to go into this with a lot of grace when you're dealing with family members, right? And at the end of the day, we want family relations to remain. We don't want to lose relationships over these topics. But I think a lot of times when we look at misinformation on the surface of it, we find that it's driven by either alignment to someone's beliefs or what they want to believe, and or that we find it tied to their fears or anxieties. Right, and so we tend to kind of lump onto information that matches those frames, if you will, to try to help us make sense of or find explanations for that information. Now, weaving this back into COVID, right, we are in no loss of information, misinformation. And I think from the very get-go of COVID, we've struggled with things. And if you go and you ever look at Google and all the search terms and how they kind of ebb and flow, you can watch this misinformation spike, right? And in the beginning, it was, where did COVID-19 come from? And it was an intentional release, right? All the way to, now it happens to be vaccinations or boosters, but it could be about masking, it doesn't really work, does it? Is it worthwhile wearing a mask? And what we know about all of these pieces of misinformation is that when it's allowed to persist and continue, we have real challenges with being able to kind of, then it becomes, if you will, infectious, right? And so now all of a sudden in your family, if someone's out there and has something that they're spouting as misinformation, we have to address it. Now, one of the things too, Jennifer, I'd like to just touch on real quick, and I know I'm being long-winded in my answer here, is the types of misinformation, because it sounds, it's such an interesting word because you think, oh, someone's using this information, but the way it's going to come across, right, can be varied. So it can come across as a joke, right, with particularly at a family gathering, right? That's very likely to happen. It can come across as a personal story or a story about a friend or someone that they knew or maybe didn't know, all right? And so we're never quite sure about that. So it comes from kind of, if you will, a personal experience. It can come from a resource, right, where they had a link that was sent to them. And it could come from marketing or even spam. So I think as you kind of look at the sources for where folks come in and how they use it in the conversations that you're having will kind of help direct you for how to kind of address those. So, I think ultimately when you're dealing, no matter where it comes from, at the end, we have to go back and figure out how do we go with family members to really start identifying when misinformation is happening, and then really helping them understand, fact check, if you will, and correct the course of the conversation to make sure that we're addressing it so it doesn't sit on the table for dessert, if you will, and linger well beyond this, because I think that's where we start seeing challenges of then vaccine hesitancy arising, where people don't want to get vaccines because they've heard all the varied stories, or they don't want to wear their masks anymore because they don't believe they need to, which is erroneous, or that social distancing somehow doesn't work as well. And so anyhow, we lots of layers to pull apart here, Jennifer, but maybe a couple opening salvos there.
Yeah, no, that's great, Dr. Job. And actually leads me into my next question, about kind of the phrases that are used in the messaging. We've often hear how people's perceptions are influenced by those phrases. For example, Operation Warp Speed caused some to question whether the vaccine was developed too quickly. Would it really work? Is it safe? So this, how the words that are used could result in a lack of or in a loss of public trust. So how can we build that trust back? And, as communicators, be cognizant of the impact our words have, and the various meanings that various people could take from them.
Yeah, it's interesting because in times of this, you start to realize that language is a very imperfect tool. And it reminds me of back when we had the war on terrorism. Everyone thinks, well, it's a war, right? But it's completely different. And I think when we use terms like warp speed, our intent was to convey speed. But then what we really created was the negative connotation, to your point, that, oh, well, then this must not have been well conceived. And by the way, we borrowed from a science fiction, metaphor around this as well that leads people to question. The real reality, of course, is that this technology that's being deployed for mRNA vaccines has been around for quite some time, and so a lot of the hysteria around I'm going to wait, I'm not going to take this vaccine, really I think proliferated early on around some of the misinformation around vaccine development, and just not having adequate information out there that yes, indeed, not only was the technology existed, it was well tested, and there was a process that was followed that we follow for every vaccine in our country. So I think when you're around the table, if you will, and let's kind of take it back to the family for a minute. The language that you're going to start hearing again is really indicative of what that person's seeing or where their information source might be coming from, right? And so some of the language can be hey, I read this story at so-and-so, and so you're listening for the source. Or if you've heard a buzzword that oftentimes can get repeated, like, for example, masks don't work, right? Okay, well, those are sometimes what you have to do with some of these key phrases that you're hearing is kind of do an initial challenge of, does that line up to what you've heard from other news sources or other credible sites? And I think one of the areas early on, I always say is, it's hard because when you're in a conversation around the table, you don't exactly have time to grab your cell phone and say, I'll check that, right? So you're kind of doing a lot of gut checking with this. But I think that's what we call surface validity, right? Sometimes you have to give a surface validity around, is that person, what they're saying adds up to the other articles that I've read or heard. Now, offline, there are sites you can actually go and check for facts. There's a website called PolitiFact, Snopes, or factcheck.org, as well as sites like the CDC or leading research institutions like Hopkins and some others. But those are, or even the World Health Organization. So I would make sure that when you're talking to family members and they're engaging and speak that you have questions about or that you kind of have a raised eyebrow, steering back to those sites, I think, is very helpful. I think the other thing too, when you hear some of these buzz terms that are out there, I think the other thing you want to be able to do is be able to help get it on the table and help discuss it and figure out where is it and why is it that they're bringing this up. And that's a critical part of this because what do they say? You have to put it under the light in order to examine it. And if it's where someone can kind of just let it loose and it lingers out there, then that kind of creates the ripple effect where then it can really continue to influence other people's opinions and thoughts well long after they've dropped the term at the dinner table. So I think those are just some thoughts, Jennifer, around keeping your ears open and then how to kind of fact check those and make sure that the information we're putting out there is indeed accurate and correct.
Great advice. Switching gears a little bit to the vaccine specifically. So now that children ages 5 and older are all eligible to receive the vaccine, do you have any tips for engaging with family members who may be hesitant to vaccine their children, even if the parents themselves are vaccinated?
Yeah, I mean, listen, I have a 13, 12, and 11-year-old, and even though I am CEO of APIC, you know, I'm a human at the same time, and I think as parents, we want to make sure that we keep our children safe, right? And I think what we find is that vaccines have a long history of providing that safeguard for our families, right? We now routinely go get our MMWRs, right, for our kids, right? We get our tetanus shots. So I think if we feed into the negative stereotype and the hysteria around vaccines, you know, it kind of takes us down a spiraling path, which is if we can't ever trust vaccines, right, then we can never really get, if you will, that level of vaccine protection that we need as a community. So I think bringing it back to home, a lot of this comes back to the best way that you're going to protect your child is, of course, getting them vaccinated. And when you read the research, and this is where I would encourage facts, is go check out the research around the studies that have been done around children, looking at adverse effects or lack of adverse effects, and really use that to help inform your own thinking, as well as, of course, talking to others about it. Because I know, for example, in my kids' school, you know, parents talk to each other. And so that's a very powerful advocacy for us to be able to talk to each other and make sense of a situation. But it can also get toxic very quickly, right? And so if you have someone that has a negative opinion that's outside, maybe not in the family, but in your community, being able to talk through, again, going back to the facts and using real life examples, right, is another great way. Is, oh, hey, you know, I know so-and-so's kids just went and got vaccinated. Right. And, you know, and they're so happy that that's behind them. And here's the benefits around it. Positive speech is a really important part of your strategy when you're addressing this. You want to avoid kind of going down into the negative rabbit hole and just kind of emotional negative charge discussions, because we find it doesn't work. And I think, you know, the other side, too, that's interesting when you deal with families and children is research shows that when you actually lead with it's better for the whole, for the community or society, that actually doesn't sell as well, believe it or not. And so when you're trying to convince someone, it's really bringing it back to themselves, their own impact, how they can see themselves or protect their children through vaccinations. So those are just some ideas and thoughts, as again, you know, really getting out there, using facts as your side, using those websites that we mentioned early on, and engaging in positive speech around it. And also, again, using some real life exemplars. But vaccinating children is so critically important to us beating this pandemic that I think, again, it's going to take all of us kind of doing the right thing, which is, as you all know, has been a challenge through this. And I think the other thing I want to address as part of this is keep in mind that, you know, we have to reserve a right to continue to be open to new ideas and new learnings. And, you know, it's because someone will come up to you and say, hey, well, in June of this year, we didn't need boosters. So why do we need boosters now in December, right? Why didn't the officials teach us earlier? Well, the reality is we continue to learn more about this pandemic, right? So we haven't had a pandemic in 100 years. And so, you know, we are really learning our way through this. And of course, we're also dealing with more mutations. And while that continues to throw a curveball, even with the latest Omicron variant, we have to realize that even some of our trusted sources are going to have new information. And that doesn't mean that it's wrong. It just means that it's timely. So
great.
Thoughts there.
Great advice. And, you know, I know that, you know, in communications, we have a phrase like, what's in it for me, when you're thinking about communicating to your audiences. And that bringing that to the individual level instead of, like you said, the societal level, sounds like it has much more impact than, you know, for the greater good kind of messaging. So just a reminder for folks, if you have a question for Dr. Jop, I will be taking those shortly. Please put them in the chat function. And another question that I have for you is kind of bringing it back up to that family level again. You know, you're having dinner, somebody is talking about something they saw on the internet, or, and almost how do you diffuse situations with families and friends, or correct information in a constructive way, versus, because we really don't want to have the food fight that you talked about earlier. So how do we kind of diffuse a situation and correct misinformation in a way that's not going to hurt feelings? Because, this is very passionate, people on both sides feel very passionately about COVID-19 vaccines and all of the mitigation strategies.
Yeah, it's interesting that you kind of have to put it into kind of a step process when you're dealing with it, and also realizing how and when is it happening. And I'll talk about that in a second. So I think, well, let me start. I'll reverse order here. There's two ways this is going to happen, particularly in a family or a social context. One of them is in a one-on-one environment, and the other is in a group environment, right? And at some level, the group environment may be more challenging than the one-on-one, right? Because in the opportunity where you want to correct or engage in dialogue with that person, one-on-one, you have that opportunity. Versus a group, you have to make a decision. Am I better to go and deal with this in the group environment to correct it, or to go deal with it individually, or both, right? So I think, as you step back and figure out how to deal with it, I think the first thing is really learn how to identify what is this misinformation. And again, going back, trying to figure out what's the crux of the matter, what is it, and then try to make sure that we're verifying that, asking that person about their sources of information. Oh, hey, where did you get that from, right? Using some of these leading questions that can be positive, but forces them to hopefully disclose either a lack of knowledge, or divulging in something that then is going to lead credence to the fact that, oh, wait a minute, you got it from there, right? So so I think learning kind of how to identify it and being a smart identifier of misinformation and helping to avoid that sharing is a crucial part. You then have to go back into that next step of addressing the health misinformation, right? Which is you sharing that very clear, accurate, easy to find information, right? That really can help drive that rational debate instead of the emotional or irrational debate that we tend to have. What we know is that, public correction, while it's very, very uncomfortable, actually is one of the best ways to sway people's opinion, right? And so if you had 5 people around the dinner table and someone comes out and says, masks are terrible, shouldn't be worn, and you say, well, where did you hear that from, right? Well, it's just something I feel. Well, hey, do you realize that the CDC has some great resources around the efficacy of masks you might want to check out, right? And then you get a couple other people around the table that talk about why masks may be important or their own personal experience. Well, now that individual's kind of left out there thinking, oh, maybe that's not exactly what I should be thinking. Maybe I'm not right, or maybe I should go do some more research. But we also don't want to actually go and have the other issue where this ratchets up into a family debate, right? And so I think, again, sometimes a private one-on-one, maybe over a cup of coffee, go outside for a second, to talk it through with them. And so you'll have to make those decisions on the fly. I think engaging is key, and again, those positive tones I mentioned earlier to you is, you might want to say, yeah, I was curious what you said about this. And again, where are your information sources? I think is a crucial part of this work. And again, I think the final piece around this is, change is hard, and changing attitudes, right, is just difficult work. But managing your own emotional response is crucial, being positive, and really avoiding that escalation. Because again, if it gets heated, gets into arguing and yelling at each other, that's not going to certainly help your family dynamic. And at that point, you probably have lost the person in terms of changing their attitudes. So it's the old adage, you get more flies with honey than you do with vinegar. So, and trying, at the end of the day, we want to change opinions and thoughts, but we don't want to make people look foolish, right? And I think that can lead to a lot of hurt feelings that sometimes it's hard to mend a broken heart, if you will.
Yes, it is exactly. Well, I have a bunch of questions coming in. So like I said at the beginning, we'll try and get to as many of these as possible. But first I wanted to ask for Mike, for vaccine reluctant individuals, he said that he's found emotional messaging is much more effective than fact-based communications. Any thoughts on that? How do we make maybe some of our more fact-based communications emotional based so that it does have more of an appeal?
Yeah, again, I think it gets back into a little bit like if you remember the smoking campaigns, the anti-smoking campaigns, right? And at the end, one of the most successful parts of the campaign was when they actually started putting pictures of burnt lungs, blackened lungs on cigarette packs, right? And so it became a very, if you will, in your face. It elicited an emotional response, right, in the individual, but it was a very factual thing, right? And I think, we have some of that, right, with COVID. The image of the patient with the intubation tube, right? Those evoke emotional elements where you think, gee, I don't want that to be my family member or my friends, right? So I think there's a place for it. I think you just have to be careful with how we do it, because it can also backfire. It could be, easily, sometimes it gets dismissed or gets twisted. So the person says, well, that person already had another underlying condition, and of course that they were going to have these problems. Or, how do we know it wasn't the flu? And so a lot of times, if you go after the emotional stir, it can be effective, but it really varies from individual to individual. I think leading with fact, or at least having fact at the readiness, is a crucial part of the success formula. So I don't want to say that all emotion is not good, but certainly making sure that our underpinnings are factually based is really important.
Great. Next question is from Stacy, and about, one of the biggest challenges is that the mistrust of longstanding institutions of trust, such as the CDC or other government entities. In the past, we could refer family and friends to those sites, but with mistrust being at an all-time high, they might not be as receptive to a trusted government source like that. Any suggestions on battling that?
So I think at the end of the day, the good news about this is that you can almost use this triangulation of information approach. And, if someone for some reason just does not believe what's on the CDC website, which I would highly encourage people to believe the CDC is a very credible website. There's certainly other ones, whether it's looking at leading research institutions, your health departments, with the World Health Organization, looking up and finding multiple sites that are validated, that are highly credible, is good ways for individuals to kind of disarm that, right? Because if you say, well, hey, even APIC, right? Hey, I went and I checked out and learned about vaccination on the APIC's website. Oh, it happens to match what the CDC is saying about vaccinations, right? And then that allows you to make some independent decisions based on factual information sources. So, I think at the end, you could go back on the whole issue around misinformation or mistrust of entities. And, that's also part of kind of, if you will, a lot of the disinformation that's out there. Is some of it is intentionally directed at trying to dissuade or get individuals to not believe in those institutions. I also think the other thing that go back on earlier is we have conflated learning new information with someone being with like an agency, for example, organizations being flat wrong. I think going back early on in the pandemic, for example, when we said, well, you don't need to mask unless you have symptoms, right, is an example. And then we started realizing that, no, actually, we needed to have that. We need to have them if you're asymptomatic. But again, we're learning along the way. We also were dealing with things at the time, like even lack of even finding masks, right? So I think as a society, we have to kind of just be open-minded that we're dealing with a constantly evolving virus. And at the same time, our strategies are evolving with it. But But I think, again, when you're dealing with family members or friends, encouraging them to use the right sources to triangulate the information is crucial. Just don't triangulate with bad sources of information, because you'll just end up making it worse, unfortunately.
Good point. Esther has a question, about a question that she frequently gets when talking about pediatric COVID vaccine. How do you know the long-term effects of this new vaccine? So how would you address that type of concern for parents?
I think if you go and look at, there's some really good research around clinical trials and how those have been conducted with these COVID-19 vaccines. And I would encourage, again, folks to go out, look at the information themselves. Again, John Hopkins had some great information, the CDC, as well as other sources. And I think reading the clinical trials, you actually will get to see that there was quite a bit of work done on this. It's not like they've released this out into the public from day one that they decided to develop a vaccine and they just rolled it out. There is a whole clinical trials process that is followed in a FDA review process. So again, leading with fact. I also think when you go back and you look at the other side of this too, is when we start talking about vaccine hesitancy. Fact will get you so far, but there is this underlying issue around just believing in vaccines and their efficacy, right? And I think helping to understand why this vaccine works, that the technology isn't new and something that wasn't tried and true. I think there are all ways that you can kind of help deal with that in the pediatric office. I also go back to one of the earlier questions around kind of emotion versus fact. And I think, as parents, again, we want to deal with safety, and safety is a critical issue when we're dealing with trying to convince parents to do the right thing, get their children vaccinated. And I think even if they're vaccinated, helping them understand that it's going to keep them safe, particularly against, as we see the changing variants that are coming out, we're going to have to continue to make sure that our children are protected through this. And I think, likening this to any other kind of, we don't want mumps running around the country, right? So we know that we're going to get our kids, their mump shot, right? Their MMWR. So the MMRs. So I think at the end of the day, it's crucial that we fight this with correct information. And again, the other thing in the pediatric office is you're talking about others in the community that you might know that are getting the shot. That really goes quite a long way to people realizing that, oh, wait a minute, half my class has gotten the shot. I think it's probably time I need to do that too for my kids.
Good advice. The next question from Michelle is kind of fun. How do you get through to those conspiracy theorists who don't trust government, but do believe, quote, data that has been hidden from the masses, but can be found on Facebook if you get on the right Facebook group? How do you either those people are probably a little more difficult to change their minds, but when they're presenting their data at the dinner table, how do you then present actual fact-based information that to maybe sway some of your more swayable relatives?
So a lot of the unswayables, if you will, or the challenges really gets back to the foundations of their beliefs. And a lot of times what you're going to find is when someone's really entrenched in their view, a lot of it is because it's entrenched into a broader view that they hold. For example, someone says all this vaccine stuff doesn't work, right? And may go back to a belief that they actually don't believe in government, right? Or that this is, they just don't believe that they're going to that anything they hate paying taxes and hope and hate, everything about engaging with the government. I mean, you have certain folks that just have long-seated beliefs. I think what you have to somewhat do, though, when you're dealing with this is try to help, again, understand where their belief is coming from, and then how to address that belief, right? And also use some of the real case stories that are out there that can help show that holding on to that belief isn't tenable, that others, it's not commonly held, right? And that they are the uncommon outlier in that discussion. And so using other family members to kind of engage in the conversation that may be around the proper information can be a way to deal with that, where, again, you can't stop that person necessarily from saying what they're going to say, but again, helping to minimize or asking again what their information sources are, having conversations around with others in your family that feel strongly in the other direction can be ways to try to get that person. The other way too, frankly, particularly if you're worried, and I know I've had some friends, whose parents, for example, won't get the vaccine, right? And we all know that. And so part of it too is trying to figure out, how can you get to that person, right? And sometimes there are people that are better sources of information or trusted than you, as their family member, even their kid, right? And so trying to figure out that if they have a best friend that they like to hang out with, engaging others, ambassadors, I call them, kind of information ambassadors, can be a good way to try to, again, get triangulation for them to hear from multiple sources. So, that's not a silver bullet, but you are, and as a society, we're going to have just some entrenched folks. But I think at the end of the day, everyone can get the correct information. It's just we have to try different strategies to reach everybody.
Those were some great points. And Nora has a question, kind of going back to what you were talking about earlier about self-centered versus community-centered messages. Do you have any, other kind of fact-based language that can be effective, but putting it in that, the what's in it for me, self-centered messaging construct?
Sure. And, again, we use this term outside of COVID all the time, the checkbook voter, right? The person that's, worried about their own pocketbook. So this isn't a new concept, and at the end of the day, behavior change oftentimes stems from, the individual seeing a benefit to themselves. Sometimes that behavior is, like, for example, when we have people that have to get their vaccines because of their jobs required, right? Like, there's an external stimulus that forces that. But I think a lot of times when it comes to the intrinsic, or trying to get individuals to use, to make that right decision, a lot of that is, again, talking about them understanding around how it's going to protect them, how it's going to keep them safe, how it's going to help protect their family members, whether it's their children. A lot of this is, again, this idea of using exemplars. If others that are out there that had challenges, bringing it back to them to say, we need to make sure this doesn't happen in our family, right? And so trying to internalize their stories and make them not just an external thing that's out there that could never happen to us, but bringing it back home, and then turning it into, and this, make sure that it doesn't happen to us. So that's one of the best strategies for addressing it. At the end of the day, we all are, there's a fear of death and sickness. There's certainly this thing about compassion for our family members and love, right? We want to make sure that safety issue, if you go back and look at the bottom of all of this, we all want to feel safe. And so if your language helps drive that home, then you're going to have a much better chance at really getting through to that person.
Great. Now we have time for probably about a couple more questions. So I'm going to take this one from Eva. She's talking about COVID testing. So, you're going to a family event and the host has asked people to take a test the day before coming to an event. Should the host ask everyone to do it, or just people who are not self-isolating or taking, specific precautions or vaccinated, and then, is it the honor system of, whether people actually do the tests and, so how do you handle that situation, the request for testing?
Yeah, so and evolving, right, as we continue
Right.
to watch the news unfold. I'll tell you, at the end of the day, the basics work for infection prevention, which is masking, social distancing, and vaccinations, hand washing, right? Those are some of the basic things we know. When we get into the holiday season, a lot of this gets more challenging because we want to spend time with our loved ones. And the days when we thought that getting a double vaccinated was enough are behind us at this point. And so we are firmly moved into the world of boosters. And with the Omicron variant, certainly we're still emerging and are learning on this even daily. I think the guidance around testing is changing, but I think to be on the safe side, considering doing testing day of, even. If you're doing the rapid test 2-3 days before, it's theoretically possible that someone actually has COVID and they tested negative on a rapid because of the time difference between the testing. So doing testing a little bit more early, later in the process, right before you're gathering, is going to be crucial. I think the other part of it too is, if really having everybody do it. If you've been vaccinated, double vaccinated, definitely. But even having a booster, it doesn't hurt to do those. It's far easier to get the rapid test. Now, your last question of the honor system, at the end that gets tricky, right? I mean, you're dealing with family members and gatherings, and who said that they did or didn't get it. It's really hard to police that. Of course, you can ask for folks to share their results. It can't hurt to do that. You may end up, getting some angry looks from some family members that feel like they don't need to send it to you. But at the end of the day, if people want to get together and enjoy the holidays together, doing the safe, right thing and being able to be transparent is certainly the right thing to do. And I think I would phrase it again, going back to safety, that we're trying to keep each other safe in our family, right? And that we love each other and we're trying to keep it safe. And I think at the end, that's kind of hard to argue with, but testing will be an important part of this holiday season to make sure that we keep COVID under wraps and keep it away from the dining room table.
Good. All great advice. And one final question. This is from Elizabeth about, what about someone who is booster eligible but refuses to get that booster because they've had a really bad reaction to the first series, like they had really bad COVID arm, or they had flu-like symptoms for longer than that expected 12 to 24-hour period. How do you try and convince them, especially now with the new variants, that the booster is the best way to have continued protection from severe disease and hospitalization?
This is a timely question because actually I'm getting my booster today at 6 o'clock. So, but all joking aside, what you have to lead with, and there's a misconception around the reactions that you get with the booster or with the COVID vaccine, COVID-19, particularly second shot of the series, is when you're getting reactions, unless they're anaphylactic reactions, allergic reactions, having a flu-like symptoms is actually part of your body working. It's part of your immune system developing its antibodies. And so I think explaining to those individuals about that, what's really happening in their bodies, it's not an accident that these things are happening. That you can, again, steer them to other articles around it. It's certainly, when we talk about trying to motivate individuals to go get boosters, and there's a potential for them to get ill or feel bad, that's tough sell, right? But at the end of the day, using the outcomes, weighing it back to the more positive benefits of, hey, when we actually get your booster, we're going to be able to get together as a family. We're going to be able to have these kinds of engagements that otherwise we can keep you safe, right? And I think, again, bringing it back home to the consequences if we don't do the booster, and then also really trying to explain the facts around what's really happening with the development of their antibodies by getting these boosters. But boosters are all in our future as we look ahead, and certainly this will be a common issue we'll all be dealing with here around the family table.
Great. Well, thank you so much, Dr. Jopp. You've given us a lot of food for thought. And thank you for everyone who participated today, especially those of you who submitted questions. Sorry we couldn't get to everything, but I think we covered a lot as we head into the holiday season. So on behalf of the National Health Council, I want to wish everyone a safe, healthy, and happy holiday season. Thank you very much, and look forward to seeing you in the new year.